Okay, now we move to the first topic of the morning. It is related on the importance of cardiovascular prevention, and we'll talk about clinical needs, and we highlight the cardiovascular prevention topics. So let's start talking about the disease. So cardiovascular disease is the number one case of death. And remember that stroke is the third leading cause of death in USA, with more than 500,000 new cases reported annually in USA. And consider that only 20 to 30% of strokes are due to severe carotid stenosis. So this means that more frequent cerebrovascular clinical manifestations are due to embolization originating from the heart or from the plaques in the carotid arteries. And the most frequent area where plaques at risk of embolization are developed is the carotid bifurcation. And plaques with below 50% of diameter stenosis that are usually fatty plaques have instability inside, and they can develop hemorrhagic focus, which generates a rupture and creates the thromboembolism in the brain. So we have to consider that the leading cause of cardiovascular disease is atherosclerosis. That is a complex process. It is related with structural variation in the vessel walls, so deposit of cholesterol, or lipid in general, and to increase in the stiffness of the carotid wall. So this is a functional variation of the vessel. And the risk factors that are behind the development of atherosclerosis are related to systemic risk, like familiarity, smoking, hypertension, and moreover diabetes and dyslipidemia, but also are related to local variation of hemodynamics, that are due to vessel geometry. So this means that if you have a wrong geometry, you may develop atherosclerosis even in presence of others, in absence of other risk factor. And talk about the relationship between flow and atherosclerosis. There is evidence that hemodynamic characteristics contribute to the plaque development. We also know that atherosclerotic lesions are mainly located at curvature, arterial branches, and bifurcation. And this explains why the most common site of carotid atheromasia is the carotid bifurcation. And we have also to consider that there are different anatomical shape of the vessels that can increase the risk of hemodynamic variation. So the clinical goal from the medical point of view is the early diagnosis of the development of atheromasia, and in the next year we need to orient our attention to determine the global risk of a subject to develop atherosclerosis in consequence of multiple factors. And this probably will allow the development also of drugs that can change the risk, working on the hemodynamics or directly on the plaque. And now atherosclerosis can be diagnosed with different technology, as Alex before said. And among the technologies, only ultrasound give not only the shape of the lumen like CT or MRI, but give information related to hemodynamics. And if we consider the ultrasound field, we have the well-known techniques like B-mode, color Doppler, spectral analysis, and now we have a new entry that is vector flow. So thanks to vector flow, we can move from the plaque characterization and the identification of flow alterations and the stenosis staging to the analysis of flow behavior and the consequence of this. So the goal for the future of ultrasound on carotid will be identify some biomarkers of cardiovascular risk for the stratification of risk in different patients, and giving an early selection of the subject at high risk of plaque development, and work on prevention by change in lifestyle, and to a personalized medicine with special drugs. So there are some well-known markers like IMT or like pulse wave velocity, and now today we'll introduce some concept about the other new markers, that is wall shear stress.